The Pediatric Hydrocephalus Foundation has partnered with the Harris Lab to create a series of awareness and educational videos on hydrocephalus. In this next video, Dr. Harris and Chris Roberts will show us where catheters are placed in the brain. Chris, where are the shunts placed in the brain?
That's a great question, Jason. So again, I'm holding, this is a shunt system, and specifically right here, this is the proximal catheter. So this is the catheter that goes into your ventricles. So here's a ventricle that Dr. Harris is holding. So it can go in one of two places. For example, it can go through the front, called anterior. So if you can imagine the shunt going right into the brain right here, and it's just sort of resting into the ventricle, sort of like a chandelier. It's just sort of hanging from the roof of your ventricle right there. Or it can go from the back, called your posterior right here. So again, it's in the ventricle itself, but it's sort of coming in from the back right there, and it's inside your ventricle right there.
What determines the placement? Is it patient-to-patient conditions that are determined?
It can definitely vary based on the medical center. So the best thing is to ask your neurosurgeon why they're using that approach. So different neurosurgeons and different medical centers choose a different approach based on what would be best for patient safety and what they feel would be best for the patient. So it's a good question for parents to actually ask your neurosurgeon which placement are they using, a frontal approach or an approach from the back, and why that's the case. And that's something they could definitely give you an answer on.
Thanks, Chris.
Of course.
Dr. Harris,
Yes.
One question that we've had as parents is, why do some patients receive the shunt in the brain and that drains to the abdomen, or some patients it drains into their heart? Why is that?
Yeah, it's a great question, Jason. Thank you. So as Chris was saying before, there's different parts of this catheter. 3 parts, right? That part that goes into the brain, the part that then comes out and touches the skull, and then the rest of the catheter that goes down into the rest of your body. So as Chris was saying, you put the catheter in, and then you might feel around, you might feel your shunt system. And that part is usually this valve. You can feel a little bit of that bulb there, and then this is where the catheters connect. Now, when we have a ventricular peritoneal, ventricular atrial catheter, or maybe even one that goes into your lungs, a surgeon is going to decide that based on what they see patient to patient. And again, all about safety. So almost always that catheter is going to go into the ventricles. Sometimes some patients have them into their lumbar system, but most often into their ventricles. That fluid can go immediately through these little holes here in the ventricular catheter, that proximal catheter. It's regulated by the valve, and then all down this tubing, this is tunneled underneath the skin. And so that's where the difference comes in. A VP, ventricular peritoneal catheter, will be one that goes right into your belly. Peritoneum is that area around your stomach. A ventricular atrial catheter, still gonna look the same. It can still be really this catheter, but what they're gonna do then is they're gonna tunnel this part rather than into the peritoneum. Maybe there's some kind of adhesions there. Maybe there's some scarring if you've had a shunt for a long time. Maybe there's an adverse immune reaction, maybe an infection. Some reason they don't want to default to that belly space, then they'll put it either in.
The Pediatric Hydrocephalus Foundation has partnered with the Harris Lab for this video collaboration. The Harris Lab is located within an Integrated Biosciences Center of Wayne State University. The PHF would like to thank Dr. Harris, Principal Investigator, Chris Roberts, 4th-year PhD Chemical Engineering student, and Aaron Gonzalez, 2nd-year PhD student of Chemical Engineering and Materials Sciences. Learn more at hydrocephaloskids.org.